1. In the context of NBHWC standards, which principle of adult learning best supports a client-centered coaching approach? A. Adults learn primarily through memorization of structured content. B. Adults value practical, real-world application of learning experiences. C. Adults depend heavily on passive instruction to retain knowledge. D. Adults are less motivated by autonomy in learning processes. 2. When evaluating a health coaching program aligned with NBHWC competencies, what is the most effective method to assess client outcomes? A. Multiple-choice knowledge tests. B. Observational role-play with standardized clients. C. Self-paced online quizzes only. D. Measuring only attendance and participation. 3. Which curriculum design strategy most aligns with NBHWC's emphasis on behavior change science? A. Developing content exclusively on nutritional science facts. B. Prioritizing hands-on practice in motivational interviewing and goal setting. C. Focusing solely on written case studies. D. Delivering pre-recorded lectures without interaction. 4. A coach demonstrates active listening by A. Repeating every word the client says. E. Waiting for the client to pause before giving advice. C. Reflecting the client's emotions and summarizing their statements. D. Interrupting when the client's narrative becomes repetitive. 5. According to NBHWC's scope of practice, which activity would be outside a health and wellness coach's professional boundaries? A. Supporting a client in developing self-directed health goals. B. Referring a client to a licensed mental health professional when appropriate. C. Diagnosing a medical condition based on reported symptoms. D. Using validated tools to track client progress. 6. In mentoring new NBHWC candidates, which feedback style is most effective for adult learners? A. Generic praise with little specificity. B. Immediate, constructive, and specific feedback. C. Delayed feedback after several sessions. D. Focusing only on mistakes without highlighting strengths. 7. When ensuring regulatory compliance, NBHWC certified coaches must always A. Store client notes without encryption. B. Follow HIPAA or equivalent privacy standards for client data. C. Share all client information with insurance providers. D. Record sessions without client consent for training purposes. 8. Which evaluation tool is most valid for measuring a coach's skill in motivational interviewing? A. Client satisfaction survey alone. B. Standardized behavioral coding system applied to recorded sessions. C. Multiple choice written exam. D. Attendance tracking during workshops. 9. A curriculum aligned with NBHWC core competencies must prioritize A. Teaching advanced pharmacology. B. Emphasizing collaborative goal setting and self-efficacy building. C. Delivering prescriptive exercise programs. D. Assessing genetic risk factors. 10. Effective communication in health coaching involves A. Using complex medical terminology to ensure accuracy. B. Employing open-ended questions to elicit deeper client reflection. C. Speaking quickly to cover as much material as possible. D. Redirecting conversations toward the coach's personal experience. 11. In the context of adult learning, experiential learning in NBHWC training is best achieved through A. Lectures on coaching theory without practice. B. Case-based simulations and role-playing exercises. C. Written, multiple-choice exams exclusively. D. Memorization of NBHWC ethical codes. 12. To ensure fairness in candidate evaluation, NBHWC assessments should A. Rely solely on coach self-report. B. Use standardized scoring rubrics and trained evaluators. C. Vary assessment tools depending on evaluator preference. D. Focus only on theoretical knowledge. 13. When mentoring, the principle of scaffolding means A. Assigning increasingly difficult tasks with guidance that fades over time. B. Giving full answers immediately to save time. C. Providing no support to encourage independence. D. Repeating the same tasks regardless of learner progress. 14. Which communication strategy best helps overcome client ambivalence in health behavior change? A. Repeatedly emphasizing the risks of inaction. B. Employing reflective listening and eliciting change talk. C. Providing a prescriptive list of health behaviors. Avoiding the topic until the client brings it up. 15. NBHWC requires coaches to respect client autonomy. This principle is violated when the coach A. Offers optional educational resources. B. Encourages the client to design their own action plan. C. Dictates specific goals without client input. D. Asks permission before providing feedback. 16. Which evaluation method ensures reliability in assessing NBHWC exam performance? A. Using multiple trained raters and inter-rater reliability checks. B. Allowing each evaluator to create their own scoring system. C. Using only one assessor for cost efficiency. D. Skipping calibration training for evaluators. 17. In curriculum development for NBHWC training programs, what is the most effective way to integrate adult learning theory? A. Use only abstract theoretical frameworks. B. Provide opportunities for self-reflection, feedback, and application. C. Require rote memorization of behavior change models. D. Focus exclusively on instructor-led lectures. 18. Regulatory compliance in NBHWC practice requires A. Documenting all client interactions clearly and securely. B. Sharing client data with family members when requested. C. Using personal devices without security measures for session notes. D. Omitting documentation if the client prefers privacy. 19. A coach practicing cultural humility demonstrates A. Assuming shared cultural values without inquiry. B. Asking respectful questions about the client's context and perspectives. C. Using a one-size-fits-all coaching approach. D. Avoiding conversations about cultural influences. 20. Which mentoring practice is most consistent with NBHWC professional standards? A. Encouraging reflective journaling and peer discussion. B. Giving standardized feedback regardless of mentee context. C. Withholding feedback until certification. D. Directing mentees to mimic the mentor's exact coaching style. 21. Which evaluation method is most authentic to NBHWC coaching competencies? A. Role play with standardized clients, assessed by trained raters. B. Short answer quizzes on coaching models. C. Online surveys measuring candidate interest. D. Instructor grading based on attendance. 22. Which aspect of curriculum design ensures alignment with NBHWC exam blueprints? A. Mapping learning outcomes directly to required competencies. B. Creating content based only on instructor expertise. C. Teaching popular wellness trends without reference to competencies. D. Prioritizing speed of delivery over depth. 23. A health coach uses silence strategically in a session. This is best understood as A. A communication error. B. A technique to give space for client reflection. C. A way to avoid answering questions. D. A method to disengage from the client. 24. In NBHWC-aligned mentoring, reflective practice is encouraged primarily to A. Promote self-awareness and continuous professional growth. B. Document every session in detail for compliance only. C. Replace all other forms of feedback. D. Speed up learning by skipping practice. 25. Which of the following is an ethical violation for NBHWC certified coaches? A. Referring clients to medical professionals when issues exceed scope. B. Sharing identifiable client success stories without explicit consent. C. Using validated assessments like the wellness wheel. D. Clarifying professional boundaries at the start of coaching. 26. An NBHWC candidate designs a curriculum with formative assessments. The main purpose of formative evaluation is to A. Measure final program outcomes only. B. Provide ongoing feedback to improve learning and performance. C. Certify learners for professional practice. D. Replace summative assessments. 27. When a coach employs motivational interviewing, which strategy is most effective? A. Correcting the client immediately when they make inaccurate statements. B. Asking permission before sharing information or suggestions. C. Providing detailed dietary prescriptions without collaboration. D. Focusing only on problem areas without recognizing strengths. 28. Which teaching strategy aligns best with adult learners in NBHWC training? A. Delivering abstract content without real-life application. B. Encouraging peer learning through discussion and role-play. C. Avoiding opportunities for learner input. Using a rigid, lecture-only format.